Good evening, everyone. Welcome to Gut Over It. It's Dr. Vivian Asamoah. I am outside because we have guests in the house and I'm supposed to do this live at 9 o'clock. Again, if this is the first time you're watching, I'm Dr. Vivian Asamoah, gastroenterologist in Katy, Texas. I'm also a functional medicine provider, and I am doing this live from my patio because the house is full of people and they kind of threw me out. So we're all set up here and we are good to go. It's cold outside. It's gonna be a quick one. Thank you guys for joining me. Tonight, we're gonna be talking about stomach ulcers. We're gonna make this fast, but highly educational. And so I'm gonna start by asking a few questions. I don't know who's on. I see some people joining on. Yes, nice to see you guys. We're going to be talking about peptic ulcer disease, and this is actually ulcers in the stomach. So you can get ulcers from many different causes, but I want to start by talking about some rare causes of ulcers that we don't always think about. So one of them is actually high producers of gastrin. So some people naturally produce a hormone called gastrin, and gastrin releases a lot of acid into the stomach. And so if there's a lot of acid in the stomach, you are going to form more ulcers naturally because gastrin stimulates the stomach cells to pump hydrochloric acid into the stomach. So this is a known function of gastrin, but an uncommon cause of ulcer. So there's an entity called Zollinger-Ellison syndrome. So we've got a friend today, that's Mr. Zollinger, who actually coined this term of a pathology where some people just hypersecrete gastrin. So if you make ulcers all the time, then we have to start thinking about this particular entity, Zollinger-Ellison, and we have to check your levels of gastrin to see whether you're one of these people. If you are, then we have to figure out where this continued secretion is coming from, because it could be a pancreatic lesion secreting gastrin, causing gastric ulcers. So we're starting off tonight, not with common causes, but rare causes of peptic ulcer disease. And the second rare one that most people don't actually think about are burns. So people who have, and this goes back to stress, right? Everyone always says, did stress cause my ulcers? Stress is causing my ulcers. And if you look way back at the literature, in the scientific literature, it says stress does not. False. Stress absolutely does cause ulcers. We notice stress can do a lot. Stress has been implicated in chronic inflammatory conditions as a trigger. Stress is implicated in cancer, right, as a trigger. We know that this connection makes complete sense to me as a functional medicine provider. When we see burn victims, so people who went through like second and third degree burns, one of the most common reasons they call a GI doctor in the ICU is because that patient is now vomiting blood, most likely because they've got stress ulcers in their stomach, right? And this is purely from stress. Burn victims, when they go through just the stress of the burn, the trauma caused to the skin, the cytokine release, the cortisol release causes stress ulcers in the stomach. So I definitely agree that any form of stress, especially chronic stress, can cause gastric ulcers in the stomach. So that's one clear association. Now let's talk about things that are more common. So we know that medications, of course, aspirin, Motrin, Aleve, a lot of the medications that your cardiologist may also necessarily prescribe for heart disease can also cause bleeding in the stomach and can cause ulcers too. But the most common one, aspirin. Another common one, Motrin, Aleve, especially if you use it continuously over and over again. All right, it's so nice to see so many people online. I know today is Saturday, so I'm not hating if anyone is not online right now because we all got stuff to do. As I said, I got kicked out of my house. We got a house full of guests and everyone said, go do your live outside, please. It's the weekend. So, but they're all peeping here, watching me doing my live actually, and listening to it as well. So tonight, guys, if you just joined on, glad to see you. Leave a message if you know someone who has ulcers, if you have had ulcers before, put an ouch in the comments, like us, leave a little bit of love, leave a comment for us, share this with someone who may have time to watch it over the weekend. But we're talking about stress, we're talking about ulcers today, and we're talking about peptic ulcer disease. We started off with the two less common forms, and we're now going to talk about the most common ones. We already mentioned medications, right? The second most common cause of ulcers is actually H. pylori. Medications, of course, beats it by a lot, but the second most common one is H. pylori, which is that nasty bacteria in the stomach. We've talked about this on previous gut over it. It's that nasty bacteria that loves to live in the stomach, latches on for a long time, several weeks, several months, and it creates ulcers. And until this bacteria is actually eradicated, the ulcers don't go away. So for the most part, how do we treat ulcers? I think most ulcers will heal when you stop the insult. So if you treat the bacteria, you stop the medications, you remove the stress, right? The problem is when you have those rare kinds from a hypersecreting tumor, you've got to find the tumor first, right? So, but a lot of the times we will treat with acid blocker medications, those proton pump inhibitors, because we know that those significantly reduce acid, which is part of ulcer formation, and also help with healing of the lining. Now, the problem is, guys, most of the time when your doctor starts you on these medications, they don't stop. And you don't need to take a PPI or proton pump inhibitor forever because you had an ulcer in 1972, right? You take it for about 4 or 5 days. You take it for about 2 weeks at the most, and your body will naturally recover. There are also a lot of very natural gut relief medications or supplements for ulcers, one of them being glutamine, aloe vera, zinc. Those are actually have been shown in the literature to help heal the lining of the stomach, right? So if you have an ulcer, you don't need to be on a PPI forever. If you're treated for H. pylori, great. After treatment, you should be off all medication, right? And if there is a tumor, we got to find where it is, okay? So I'm going to keep it short tonight, guys, because it's Saturday night. Thanks for joining me live. If you guys have any comments, go ahead and put them in. I will answer all comments later. Was just trying to keep this short and sweet. My name is Dr. Vivian Asamoah. I am a gastroenterologist in Katy, Texas. I am also a functional medicine provider. We are definitely accepting new patients. I set myself on this target mission to do one evening live every night at 9 p.m. The series is called Gut Over It, just talking about common GI issues that you may have questions for your gastroenterologist about, or your primary care provider are not sure. So again, share this post to anyone who you think may have ulcers because they ouch all the time.